We are going to do a little Transparency Tuesday today. Did you know that there are actually strict insurance and legal requirements behind how we document vaccines or even decline vaccines, even in a vaccine neutral practice like ours? When a vaccine is given, we're required to document things like lot number, manufacturer, site of injection, date, and that you receive proper counseling. But even when vaccines are not given, people don't realize that there are still requirements that have to be addressed in our documentation and in our conversation. Those things include risks and benefits that were all discussed, questions were answered, and that the decision was made by the patient or parent to decline the vaccine. And in many cases, you may be asked to sign a vaccine declination form. And essentially, this is especially important for things like HEDIS. And HEDIS stands for Healthcare Effectiveness Data and Information Set. It's basically a system that insurance companies use to measure the quality of care that patients are offered at a medical office or by a provider. That includes tracking whether recommended things like vaccines were offered even if they were declined. So that signed form helps show that we as the provider met our responsibility and covered those topics with you. And this isn't optional on our end. Medical offices are regularly audited by insurance companies if they take insurance and other regulatory bodies. So if documentation isn't done correctly, it can lead to denied claims, having to pay money back from the medical office, financial penalties, and even loss of insurance contracts. So that means we wouldn't be able to take patients that have a certain insurance. So when we take time to document or ask for a signature, it's not about pressure and it's not about judgment. What it is about is protecting our medical record, our medical license, protecting our ability to stay in network, and thus making sure that we can continue caring for patients in our community and caring for everyone. At the end of the day, our role is to educate, document, and support your decision. It's not to make it for you.